Greetings. My name is Jed Shlackman, and I'm a holistic mental health counselor here in Miami, Florida. In this video presentation, I will be discussing the topic of ADHD, or Attention Deficit Disorder, Attention Deficit Hyperactivity Disorder. This is a topic which, of course, there has been a lot of public discussion and controversy about. And my approach is a holistic approach which looks at the whole person, at their environment, at all the different levels of factors that may be contributing to the visible symptoms. So from that perspective, having the diagnosis or the label given doesn't necessarily give a clear picture of what the causes may be or of what an effective treatment approach might be. So we have to look at each case in its own merits. Each child or adult who is given a label or diagnosis of ADHD has their own unique experiences, their own challenges, and there are multiple levels or layers of factors that can contribute to the symptoms that are associated with that diagnosis. So if we look at what a mental health diagnosis is, it's really going through a set of symptoms or a checklist of criteria of observed behaviors or subjective feelings and seeing if those are in any way interfering with that person's ability to function in their environments, whether it's their family environment, their school environment, their work environment, etc. So there are some people that might have certain symptoms, but they appear to be functioning just fine in whatever environments they live and function in. So in those cases, according to the diagnostic criteria, they would not be given the diagnostic label since those symptoms are not impairing their functioning in any measurable way. Now we have to remember that these are subjective approaches to diagnosis, which is for the most part how mental health and psychiatry function. So we're not giving clients or patients specific physical tests or blood tests, things that are measurable within their body that tell us they have a specific illness or condition. It's really a lot more subjective. When we look at the patterns of behaviors or symptoms that people do label as attention deficit disorder or ADHD, we see that there are some things that would be concerning if we want a person to function in a healthy manner. So we're not saying to just ignore and do nothing about this and pretend everything is just perfectly fine and we shouldn't have any concern. So we do want to help individuals who are having challenges in their ability to succeed in life in whatever endeavors or relationships they're involved in. So looking at the symptoms that we would look through to give a diagnostic label, we'll find things such as being impulsive, having poor concentration, being overactive, which they used to call hyperkinetic, which makes it sound more scientific, but it just means you're super active in motion all the time. Being fidgety, having difficulty following directions or complying with directions. Also, someone who tends to jump from one thing to another without completing it. So those are some of the common observable phenomenon that people associate with ADD or ADHD. Now, if we are thinking about causes, what causes a particular symptom or behavior, that's a little more complex to consider because there's multiple levels of causes. So if someone is bored with a particular task that they're doing, they're likely to want to go on to do something else or get distracted by other things. If someone has too much going on in their environment, so too much stimulation, that could be too many people talking to them, too many electronic devices that call their attention. Could be any number of things that are stimuli. Well, if you're overloaded with stimuli, there's different ways you could respond. One way is to try to pay attention to all of it, so to multitask, or at least try to. And another way could be to just tune everything out and sort of not focus on anything. If we look at the idea of stress as it relates to mental health, we'll find that stress or trauma of one kind or another can usually be correlated with just about any mental health diagnosis, in particular the more common diagnoses. So depression, anxiety, ADHD, phobias, all these different things that people are challenged by often stem back to how they are coping or responding to stressful stimuli in their life. With ADHD, one theory is that it's an adaptive way to handle an environment where you need to be vigilant. So that's going back to what they call the hunter-gatherer idea, where people who lived in an environment where you were hunters, where you would have to be on the lookout for predators, or to be a predator looking out for a possible food source, you're constantly scanning your surroundings, so looking for stimuli that might be significant. In our modern society, most of us are not needing to go out and hunt for food all the time, but we may have other forms of stress that we're trying to alert ourselves to or protect ourselves from. So children that experience some type of abuse or neglect may have a greater risk for developing the types of patterns that get labeled as ADD or ADHD, as well as other mental health conditions. So if we recognize that there's some type of stress or trauma present, we would want to work on helping that individual heal or address that stress rather than just giving them a pill or medication that very temporarily will relieve the symptom. So for true healing, we don't just treat the symptoms. We're looking to address that person as a whole and really get to the root of that issue or pattern and provide that person with resources and methods that can really help restore balance and harmony. So for children who do exhibit the symptoms that get labeled with ADD or ADHD, it's often important to help them learn to handle stress, to cope with stress in more healthy, more positive ways. Looking at different forms of research, different studies that have been done relevant to factors that can cause or aggravate ADHD, as well as methods that seem to help treat or reduce the symptoms of ADHD. We find that things like exercise, spending time outdoors in nature, also things that relax the body like massage, yoga, meditation, breathing. These are all methods that can help restore more balance or harmony to that person. It can help settle down their nervous system, and it can restore and replenish the natural flow of energy so that they can focus on something if they need to, or they have a motivation to do so. Also, the child's learning environment can be very important. Different children, as well as adults, have different styles of learning, different ways that they're able to learn things more effectively. Some people are more hands-on learners. Some people learn things by watching or observing others. Some people are more auditory, so they'll be able to learn things by listening to someone speak or describe it. So there isn't really a one-size-fits-all approach for education. We have to relate things more to the individual styles of learning for each child. And we also want to provide an atmosphere that's supportive, that makes the child feel that they're competent, that they're able to be successful in whatever pursuit they're engaged in. So a teacher that's very harsh, that tends to demean children, that is very critical, that teacher might cause a lot of problems for a child who's more sensitive, who's having some difficulties focusing or learning. So if a teacher is more calm, able to communicate more effectively with a child, helps that child feel more secure, more accepted and supported, that child has less stress and that child will more likely be able to concentrate better. That, of course, is the case in the child's home environment as well. Children who have a lot of stress at home may have difficulty focusing, difficulty listening and concentrating because they're used to handling that stress in ways that are not conducive to listening and learning. So imagine you're a child whose mother or father or aunt or uncle or grandma, whoever the caretaker might be, is very frequently yelling at the child, chastising them, criticizing them, looking for their faults. Well, that child, in order to protect themselves, will learn to tune that out. So over time, they just don't want to listen anymore. They want to escape in one way or another. That escape might be going to grab a video game and being immersed in that for hours on end. The escape might be going outside and hanging out with friends. It might be escaping with some form of substance abuse or other habits. So even with addictions, we can see where those often trace back to how a person has learned to cope with or handle psychological stress or trauma. As a society, most of us do have some level of issue with stress and trauma and with addictive behaviors. It's not always the obvious overt forms that people may think of. So not every addict is abusing drugs or alcohol. Some might be compulsively shopping, compulsively working, gambling, in addictive relationship patterns. With stress and trauma, not everyone is a classic PTSD case where they're reacting to some type of combat injury they experienced 20 years ago. It might be other forms of stress or trauma where their way of adapting or defending themselves is more subtle. So if we look at those issues and bring our focus back to the topic of ADHD, the ADHD behaviors can often be ways that people have learned to cope with stress. And that stress could be on multiple levels. It could be social stress, which includes the family environment, the school environment. It might be physical stress, so someone could actually have some physical abuse occurring. It could also be physical in the sense of physiological exposure to things that are stressful to the body or harmful to the body. So if a child is being, you could say, overdosed with unhealthy foods or chemicals, such as having 3 sodas a day, such as having foods filled with artificial colors or flavors, artificial sweeteners. Well, not everyone's body is the same and can handle or process all of that. So some people who are more sensitive, who are less adapted to handling stresses, they may go into a very unhealthy reaction when they're exposed to those things. So they may respond to the physical stress pretty much in the same way they would respond to the psychological stress. We also have to consider how society looks at these children and responds to them. So if these children are being given a label, being told that they have something wrong with them, which they're not going to fully understand, just as their parents probably don't fully understand the situation, well, that creates some stress or anxiety for the child. Just the idea of thinking you have some form of disorder or disability and then being told that you need some special form of treatment, and that could be any kind of treatment, whether it's a medication, a behavioral plan, some alternative therapy, whatever the intervention might be, the child can become self-conscious about that, feeling that they're getting some form of special treatment, that they're somehow different or not normal. So whether you're a parent, a teacher, a doctor, a counselor, you want to be conscious of how the people that you're working with are seeing themselves in that role of the client or patient, of someone who's getting that form of help. So let's kind of summarize things at this point. We're talking about ADD and ADHD and looking at them from a more holistic perspective, where we want to look at the whole system that person is a part of. So everything about their environment and how it's affecting them. Also looking at the internal environment within that person. So that includes things like their diet, their nutrition, their lifestyle, if they're getting enough sleep, drinking enough water, getting enough fresh air and sunshine. Some of those may seem like simple things, but something very basic and seemingly obvious can often be ignored, and ignoring it could make a big difference. So we want to consider all those elements and not neglect them. The other point we've made is that with mental health concerns, a common denominator is usually how a person is responding to or coping with some form of stress or trauma. So in a particular situation, that way of coping or responding may seem helpful or adaptive. So someone who's dealing with anxiety and takes a medication that relaxes their nervous system for the time being may feel like that's helping them, at least for the moment. But in the long term, it's not teaching them their own internal skills and abilities to handle stress and anxiety. And it can, you could say, prepare them for a pattern of dependency. Some people have remarked that the psychoactive drugs, the medications that are given to children very commonly, have now become the most common gateway drug, since children 5 or 6 years old now are often using those types of medications, and they're using that before they've ever tried any recreational drug, before they've ever had alcohol, marijuana, cocaine, amphetamines, anything else that they might end up using as they get older. Well, if the children are experiencing some type of difficulty and are learning that the way to shift their state, their emotional state or their thinking state at that time is to take some form of chemical substance, that's not really empowering them. It's making them dependent on whatever that substance might be. Now, if a child's getting a prescription from a physician, that's something that's being monitored and regulated, so they may appear to be more stable if they're consistently taking that medication over a long period of time. But in the long run, it appears, based on a variety of studies that have been done looking at long-term effects, that it's not really helping them overcome the underlying issue or challenge. So the medicine is not healing the trauma, it's not teaching them new ways to cope with stress or trauma, new ways to handle things that are present in their environment. So as a holistic therapist, my wish is to empower people, to help them find natural solutions that won't cause side effects or any negative long-term outcome. I encourage people to develop healthy lifestyles, which includes the way they eat, the way they live their life, which includes the way they interact with other people, getting enough sleep, enough exercise, their thinking patterns, so you could say their cognitive schemes, cognitive structures or belief systems. So just the way we think and believe, the way we relate to the world around us is going to have a big effect on how we're able to handle whatever's coming up in our life. So looking at that part of it, we teach people how to reframe the way they look at stressful or challenging situations so that they're not overwhelmed by it, so that they believe in their own power to handle things, to be successful, to achieve what they need to. And then there's the emotional part, how we're able to process or handle emotions. In our society, we often don't have a healthy outlet for our emotions. So we don't get to speak, to share them with other people. We're not allowed necessarily a healthy creative outlet. Things like art and music and drama and creative writing, those can all be beneficial ways to process our feelings because we're able to take them out of ourself, to express them in some way so that we can reflect upon them rather than being overwhelmed by them. In modern schools and other areas of our society, people often don't have the opportunities to use those forms of expression. There are many families where children are taught not to speak up or not to speak back, so their ability to express what they're thinking and feeling is denied. Over time, that leads those emotions as a form of energy to build up within them. And when it builds up, it can have physical effects, so it can promote physical ailments or illnesses. it can also lead to very impulsive reactions at certain points when the person can no longer contain the emotions. So there are people that are able to keep it in for certain amounts of time. So they keep a facade, let's say, that they present in their social environment, but they can only maintain that to a point. And once something pushes them over the edge, then all that emotional energy just unloads and they can react in a very extreme way. And that's not something that is desirable, of course. We don't want to promote people having it boil over that way. It's healthier to have an outlet to express things before they build up. If anyone listening to this, either themselves or someone they know, is having challenges with symptoms that have been referred to or labeled as ADD or ADHD, it's very important to look at this topic in a more comprehensive way, to get multiple opinions, to thoroughly examine the different factors that could be contributing to that situation, the different levels that are involved, whether it's physical, emotional, mental, spiritual, environmental. And then once you've gone through that more thorough, more comprehensive evaluation of things, then you have the opportunity to provide support or interventions that are more likely to create positive change. I hope this discussion has been helpful, and I encourage anyone who would like to learn more to visit my website at www.phinsights.com. That's www.phinsights.com. And I want to thank you for taking the time to listen to this presentation. And very well, I wish you all a good day.